Northwest Territories. That's where we're going to begin here on Power and Politics, where fires continue to rage. Now that Yellowknife's evacuation deadline has passed, thousands have fled the capital. People are being moved across Western Canada to areas of British Columbia and to Alberta. Others are seeking shelter within the territory. Julie Green is the Minister of Health for the Northwest Territories. Minister Green, thank you for joining Power and Politics today.
Oh, you're very welcome.
I do have some questions for you, Minister Green, in your official capacity, but I have to begin with your personal situation. Where are you right now?
Well, right now I am in the campground at Fort Providence, Northwest Territories, which is about a 3 to 4 hour drive from Yellowknife, both south and west. And I'm here with my family. We are in this holiday trailer, and we plan to wait things out here.
Are you okay? Is everyone okay there?
Yeah, we are okay. I think we have a pretty typical situation here. We have a young person, my daughter, who's 28, who's with us, and then we have an elderly friend with mobility issues with us as well. And so I know this has been a hard part of the evacuation, people who have mobility issues. So we're taking care of her, and I know everybody else is trying to take care of the elders to make sure that they have what they need.
Absolutely. Yours is a common experience. You're sharing this with thousands of people in the territory, and I'm sure you empathize with them fully. But your actual evacuation process, how did it go?
Well, it went really well, actually. We decided to leave at 5 o'clock yesterday morning from Yellowknife, thinking that there would be the least amount of traffic and the least fire activity. So there were no delays. We got right onto the road, very thick smoke going from Yellowknife to Boundary Creek, which is about the first 50 kilometers of the highway. And then once we were through Boundary Creek, the smoke lightened up quite a bit. We could see all the burned forest around us on each side of the road, the devastation from the earlier phase of this fire. And then once we were through the Betchico Junction, it was blue skies, and it was a really nice drive, no issues.
Well, thankfully out of harm's way. And there you are in this now quasi-official command center for the health ministry there in that camper. And let me turn to some of the official questions I have for you. I want to focus on Stanton Territorial Hospital. It is the largest in the territory. The fire is 15 kilometers away from it. What are the plans for the patients? I understand there are some evacuation plans in order.
Yes, that's correct. This afternoon, we expect the rest of the inpatients to be evacuated to the BC Lower Mainland, where they will be welcomed into that health care system and taken care of. So these are patients from medicine, obstetrics, psychiatric, all of the different wards in the hospital, about 80 people altogether on a military flight this afternoon to the BC Lower Mainland.
So will anyone or anything be left at the hospital, or will it be completely shut down?
The hospital will not be completely shut down. There is emergency room services available as usual, staffed by a combination of our staff, medics, privately employed medics who we've contracted, and military medics as well. So people who need emergency room services can still go to Stanton Hospital and receive them there. If there is a need for continuing care, people won't be admitted, but they will be medevaced to likely Edmonton in order to receive additional services.
Okay. Hopefully it will go smoothly, this planned evacuation of the remaining patients, because yesterday what we were hearing was patients were supposed to have been flown out, but the flight had to be canceled, and it was quite dramatic and traumatic for the people involved. Are you aware of what happened?
Well, my understanding is that there was a misunderstanding about the status of the military plane that we're using for this evacuation. We thought it was coming. They didn't think we had confirmed our request. So there was that mix-up, and I do apologize to all the patients who were set to go yesterday and then had to return to the hospital for another night.
Okay. But in the end, on that first military evacuation flight, 79 long-term care patients were able to be evacuated, as I understand it. Is that all the long-term patients accounted for now, Minister?
Well, actually, the long-term care patients were evacuated earlier in the week, and these were long-term care patients who came from Fort Smith to Hay River,
Okay.
and then when Hay River went on to an evacuation order, both Fort Smith and Hay River long-term care patients came to Yellowknife. So the whole kit and caboodle were moved earlier in the week. We have a nonprofit long-term care provider, Avens, and I understand that they have relocated their patients as well to Alberta. And so to the best of my knowledge, all the long-term care patients have now left, and all the supported living patients who were in other types of programming, they have all left as well, and they were welcomed in Alberta as well.
So that is good news at this point. You did mention that essential services, emergency services, are going to remain at the hospital. What about the staff who have to stay behind to provide those kinds of emergency services? What are you doing to make sure that they're okay and will be okay at the end when they're able to leave?
Yeah, we have flights starting tomorrow. We have 100 seats available on a flight tomorrow to fly out essential workers to Alberta so that they can be reunited with their families, or if they don't have families, just to escape the smoke and the anxiety of being in Yellowknife. In the meantime, I'm pleased to say that the grocery stores have made an effort to stay open a little longer, and so there shouldn't be any problems keeping people comfortable while they're also doing this essential work for us, which we appreciate so much. I understand the anxiety is very high, and watching your family go down the highway without you is really traumatic. So we appreciate those people who've been able to hang on and help us through this period.
I look forward to sharing some of those stories of healthcare heroes. I'm sure we'll be hearing more as they come to the fore. Are you in a position right now to think at all long-term, Minister Green? Are you thinking about the kinds of supports that will be necessary when people start being able to return to Yellowknife?
Well, that's an interesting question, Heather. We just had a preliminary conversation about that today. And I think that the way in which we tried to get people out ahead of time will be bringing people back after the main crush has returned to Yellowknife, so that there isn't competition for resources. We have all the staffing in place, whatever needs to be done to ensure the hospital as infrastructure is ready to receive them, that all of that is ready. So I'm going to say now that they won't be the first people back, but once we're set up and ready, they will be welcomed into a fully functioning place with the adequate staffing and resources to make them comfortable.
We will definitely have conversations then. Is there anything else immediate, Minister Green, that I should be learning about? Any immediate health or medical needs that we haven't addressed today?
Well, we are still operating the evacuation center, which is not where people register for flights. It's where people stay overnight if they don't have other accommodations. So, for example, Heather, the hotels evicted their guests because they were closing. So we had at least a couple of those people in the evacuation center last night, along with 16 other people in the evacuation center. But we're thinking now that the evacuation of the most vulnerable population without resources is winding down, and the evacuation center will close at 8 p.m. tonight. And it's my understanding that there will be some kind of sheltering in place plan, which will take things forward from here.
Minister Green, I wish you well personally with your family there and the situation in which you find yourself, and of course, as you carry out these duties looking after the people of the territory. Thank you for speaking with me today.